theme, COVID-19 pandemic in Nigeria, a PANACEA to national development. As you mentioned, I am your host, Georgina Ndukwe-Ezeanyika. Now, let's start off, first of all, with what we know about the COVID-19 pandemic. We all remember in December 2019, of pneumonia cases from an unknown virus
we know about COVID-19
in China.
We all remember in December.
Based on initial laboratory findings, the disease now named coronavirus, which has been abbreviated to COVID-19, was now described as an infectious disease caused by severe acute respiratory syndrome, and the outbreak has since spread to over about 196 countries in the world and territories. Every continent has a case or two. Now, there have been ongoing efforts to ensure that the spread is curtailed, and we know that scientists world over are working to ensure that they come up with a vaccine. I don't know if anyone has been approved yet by the WHO, but I know that some countries are working on getting a vaccine. Now, beyond the tragic deaths, we've had over 400,000 cases. Some countries have even about hitting the 1 million number mark, and numbers of cases who have died, or people who have died of COVID-19 related illnesses. And beyond this tragic hazards and human consequences of COVID-19, we have seen a shutdown of the global economy. We've seen economic uncertainties and disruptions that resulted as a result of this, and it has cost different countries huge amounts of money, Nigeria including. But today, we are going to take a look at how we can make use of this situation and turn it around in our favor. How can we ensure that Nigeria continues to develop? How can we ensure that we still advance the growth of Nigeria's economy? And we'll kick off with a welcome address. Let's be welcomed by the Kapun, the National Association of Sea Dogs, in the person of Mr. Emmanuel Bahabo. If you can hear me, please, the floor is yours. You can go ahead.
I can hear you. Thank you very much, Georgina Ndukwe-Ezeanyika. It's my great pleasure and honor to welcome all of you to this webinar or seminar organized by the National Association of Sea Dogs on the subject of COVID-19 pandemic in Nigeria, Partnership for National Development. This is one of the programs, thought leadership programs that the association does from time to time to try and find solutions to nagging problems, bring opinion leaders together to brainstorm, and hopefully we distill ideas from which we can pass on to policymakers to help us achieve our objectives of making a difference in society. Now, this is organized by the medical mission of the National Association of Sea Dogs. And the medical mission is a health intervention program of the association. And part of what we do is to give medical equipment to health facilities where they are needed. We pay medical bills for indigent people. We organize free medical missions from here and there every quarter, at least in every part of the nation where there's a critical need and the government efforts are not reaching. We support various hospitals in so many respects in our intervention program. So this is one of those programs that we thought we should do in the wake of COVID-19 to try and get the people thinking beyond the panic and the fear of the virus. We have to think of rejuvenating the economy. We have to think of going forward. I mean, we can't all dwell on the harm that the pandemic has caused us. We must think of how this can be turned around to some sort of stimulus for development, if you like. If someone had told you and I, say by January, that the world will practically be brought to its knees by some flu, I'm sure all of us would have scoffed at the thought. But here we are. People couldn't go out. You couldn't even hug somebody. You couldn't be with a loved one who was passing their last moments because of the disease. So it's been a very terrible situation. The National Association of CDOG thinks that we should start thinking of how we can turn this fear around to a stimulus for development. Yes, the spread of the pandemic and the collapse of the oil prices has crippled most economies, but someone has to sound a warning about what needs to be done. There needs to be bold economic reforms. There needs to be strong fiscal and monetary policies. There needs to be conscious effort to turn the economy around and drive investor confidence and help the economy develop from all of this. And all of this requires very, very serious and focused thinking by policymakers. And these are part of what we think that this program should help stimulate discourse along those lines. And I'm quite grateful that we have very important people here, very significant thought leaders like Professor Chidi Odinkalu, Dr. Daniel Otoh, and Dr. Emeka Okengwu, who have agreed to share their thoughts with us on these issues and how we can look at the pandemic in the face and see how we can use what it has cost us and turn it around as a panacea for development. So I thank you very much for being here, and I welcome you to listen and enjoy. Thank you very much.
Thank you. Thank you so much for that summary of what exactly this webinar aims to achieve. If we can get policymakers thinking, if we can get people working towards ensuring that we move past COVID-19, what happens beyond now? What happens? How do we learn to live with this? How do we learn to exploit our situation in our own favor, which is what this discourse is going to, we are going to bring up issues, we are going to bring up ideas to ensure that we are able to move the nation forward. And of course, we are hoping that the relevant authorities would listen when we pass these issues across to them. Okay, so let's move ahead. We've spent much time. We have to move quickly. Our keynote speaker is a man I have great respect for. I have admired. I have listened to his views and opinions on different issues, and they are always of great value. Professor Chidi Odinkalu. Let me just give you a summary of who he is. What he has achieved so far. He's a senior team manager of the Africa program of the Open Society Justice Initiative. Professor Odinkalu is a lawyer, an advocate from Nigeria, and currently also chairs the Governing Council of Nigeria's National Human Rights Commission. He received his PhD in law from the London School of Economics and Political Science. Now, before joining the Open Society Justice Initiative, Professor Odinkalu was a senior legal officer responsible for Africa and Middle East at the International Center for Legal Protection of Human Rights in London. And his achievement goes on and on and on. He has published articles, journals on diverse subjects of international law, international economic and human rights law, public policy, and political economy as affecting African countries. And we are honored to have him in our midst today to give us his own views on the theme for the webinar today. Thank you so much, Professor Chidi Odinkalu, for participating in this webinar. And I'm giving the floor to you to kick off to give us your keynote address.
Thanks a lot. Good afternoon, ma'am. Madam Ndukwe-Ezeanyika. I hope that's the name.
Yes, you're correct. Thank you so much for joining us. Really appreciate your time and patience.
Thanks a lot. You're much too kind. And my thanks as well as apologies to the the NAS. I came on at 3 o'clock, but then I didn't see anybody, so I had to go and cook. Sorry about that. I know that's not part of the agenda, but I really had to go and cook. I've not had breakfast and I was hungry. And so that's that. And because I see that some colleagues have been trying to chase me up, I should apologize to them. But really also to thank NAS for keeping on top of the things that matter to us, not just within Nigeria, but really as Africans and as Black people as well, and looking out for the diaspora. Quite clearly, this is a significant subject matter at this particular time. I should also, I just, the subject, I found the framing of the theme intriguing. COVID-19 pandemic, a panacea to national development. And I didn't want to pass the theme, but it struck me that it was panacea to, not panacea for national development. This is the kind of thing that lawyers like to do, parsing words. And my reading of it was that this was supposed to be, because a lot of people may not see national development in this, but this is a conversation called to explore how this can be an inspiration for national development. And within that context, therefore, of discussing it as inspiration, as a moment, as an inflection point, we also need to do honest diagnostics of where we are and why we are where we are. I really mostly now spend most of my time in the citizen sector and sometimes in teaching and thinking sectors. I no longer do law as such. I used to be a lawyer, I like to tell myself. And this is COVID-19 is a public health crisis primarily, and my hope is that I'll cede this momentarily to experts in public health to lead the conversation. But managing a public health crisis is a leadership challenge, and that is where this. So I have no expertise in public health other than being a beneficiary and occasional participant in it. But it is the leadership challenge that connects pandemic response and management with our current moment. And in that leadership challenge, one thing is quite clear: we have failed, and we should be honest to say we have failed. This crisis has clearly shown us up, and in a way that is not particularly nice or enchanting. Now, and development is also a leadership challenge. And therefore, if we are going to transition from this to development, we've got to address our leadership crisis. And why is this important? This is an inflection point, not just for Nigeria, but for the human civilization, for human race. And, life is going to be dated for the next generation and two in terms of BC and AC, before COVID and after COVID. Pretty much all parameters have changed, from the workspace to real estate, to travel, to management of hydrocarbons, to climate change, to energy, to governance, to parties. Everything has changed. And the question we've got to ask ourselves as a people and as a vocation of professionals and citizens is, how are we configured to confront the challenge of this radical transformation in the way we do things as a human race? Or are we in Nigeria? Now, to get to that point, you ask yourself, how have we fared at this moment? And as I said, we have failed quite badly. But there are some positives. Nigerian elites are now dying inside Nigeria, which is good. It means we are saving money on cargo costs. We are no longer having to cargo dead bodies of rich people from Switzerland or the United States or the United Kingdom, paying all that money and the associated freight and preparation and undertaker costs to white people, all that money is now going to Nigeria. But we're losing customs revenue because when dead bodies are cargoed to Nigeria, we've got to pay some customs duties to import them back into the country. But that really is the silliness of our situation. You know, we produce crude and import refined oil and refined products. We also produce human beings and import dead bodies. And now, because of COVID-19, we are no longer having to import dead bodies. We are now producing dead bodies in Nigeria and dead bodies of rich people. That's a good thing. Because if they die and all of us here are mostly rich by Nigerian standards. So if we die in enough numbers, Nigeria will change because we will begin to put in Nigeria the kinds of things that are required for Nigeria to change. In Kenya now, rich people are building ICUs inside their own houses and hiring medical doctors and medical professionals as domestic staff in their own houses. It will not save them because every society needs a functional public commons. Those things that are required to make society serviceable, you call them public goods plus public administration, plus institutions of administration of justice and dispute resolution. In Nigeria, we've destroyed all of those and values that should sustain them. And because we've destroyed them, no amount of money will save anybody. And this moment is showing that up because it shows the failure of our social contract. The contract between citizens and the state and government in Nigeria is no longer serviceable if it ever existed. If it ever existed. Citizens don't believe anything government says. People don't even believe that there is anything. Most ordinary people don't believe that there is anything called COVID-19. Our responses have been maladapted because we have leadership that does not think or care. So you look at our response, lockdown and social distancing, and what else have we done? Stay at home. And how has that worked? Lockdown in a system in which most people are in the formal economy, from citizens to consumers to producers to markets. Most of us are in the informal economy. And therefore, you lock down, you destroy the viability of human life and communities, and you raise crime, mental health with no mitigation and all of that. That is exactly what we face. We are told stay at home in a country in which over 30% of people don't have homes. You are told social distancing in a society in which informal settlements make up a majority of urban settlements, and in settlements in which there is nothing like the possibility of social distancing. And we are told that the biggest preventative measure here is washing hands in a country in which over 60% of people suffer from water hunger. So how did our government respond? Absolutely nothing. And what were we told? Well, palliatives. Palliatives are what people use to destroy human agency. And so, for those, in my own part of the world, you give palliatives to somebody called Ogbenye. Now, for those who speak my language, my parents' language is Igbo. Ogbenye now comprises two words, Ogbe, which is neighborhood, and Nye, which is give. So Ogbenye means the neighborhood gives you. Basically, you're dependent on the society, on your neighbors. That means what? You're a parasite, you're useless. You're dependent on the labors of others. In a society where dignity is the foundation of everything, nobody wants to live on palliatives. And when government is telling its citizens, oh, well, you know what, we are going to give you palliatives, the government itself is useless. And that is really what leadership in Nigeria is. It is useless. It services itself. What did we do? We set up a presidential task force headed by the SGF, who is an appointee, of the president. And so there is no political accountability and no political leadership. And you can see what the SGF does. He's limited by his own circumstances, but the presidential task force is absolutely irrelevant and useless. But we cannot say so because in Nigeria, we are not supposed to tell big men that they are useless. But the SGF's presidential task force is utterly useless, absolutely useless. It cannot do anything. It has no scientists. Who does it have? It has APC time servers. And they are doing party political stuff. They're not doing anything that is supposed to serve the country without politics in it, which is why the Minister for Humanitarian Affairs can say some of the things she says. And, you know, you have to be ashamed for her. But she says them because she sees herself not as a Nigerian minister, but as a party political minister in a time of crisis. Failure of social contract, failure of leadership, something else is happening, failure of data. You can't do development without data. So people will stay up at night to listen to these figures come out from NCDC, and we're not supposed to criticize NCDC. My good brother, our good brother Chikwe is there. But NCDC is part of the problem because it's given Nigerians the impression that the infection is just what it is. Rather than tell Nigerians the truth, we are not able to come out with proper numbers. And all we're doing is trying to manage. NCDC is giving people the impression, oh, well, the numbers are small, so you can deal with it, okay? Which is not true. And I listened to find out whether anybody will reflect the numbers from Kano after the certification by the minister in the NCDC numbers of mortality. They have not been reflected. And according to the minister, 979 people died, of whom somewhere between 50 and 60% were COVID-related. How much of that is reflected in the numbers? Zero. Where is the Nigerian curve? It does not exist. So what is happening? But Nigerians are saying we flatten the curve. There is no curve because there is nothing to flatten in Nigeria because there is no curve. Why is there no curve? Because we don't do data. We are afraid of truth because numbers make us honest. But our political economy cannot be founded on honesty or numbers or truth. And therefore, instead of flattening the curve, we are frightening the curve. The curve is so afraid, there is no curve for Nigeria. And it's not just on this that you don't have any curve for Nigeria. On everything that you can think of, Nigeria does not have a curve. The book, Planning Without Facts, was published in 1966 based on development planning in Nigeria. And that is still what we are doing. Over 50 years later, we continue to plan without facts. And you cannot develop without data or facts. Yet that is what we do. And therefore, we cannot defend the public good. You know, I hear the desire for us to make haste, and I want to try and round up in development and find inspiration in development for this. It's not going to happen in a haste, because to do that, we need to walk back. We are led by a president, in my view, who does not see himself as a Nigerian. President Buhari sees himself as a northern Muslim. So first thing, you've got to find a leader for Nigeria for whom only one thing matters, Nigeria. That leader has got to be one that can give every Nigerian, irrespective of where they come from, and irrespective of how they worship, and irrespective of their gender, a sense that Nigeria belongs to everybody in it, and everybody who is willing to claim it. At the moment, that is not so. The only thing that unites all of us in Nigeria is mutual suspicion and mutual lack of belief in its viability. You cannot develop a country when there is no country to fight for. The first thing is we need a leader like that. That means for all of us in this seminar, 2023 must matter. How many of us are willing now to call ourselves Nigerians, not Igbos or Yorubas or Hausa or Fulani or Birom or Ijo or Efik or Ibibio, or that is part central to the problem. We don't have one virus, we have many viruses. This is the list of the viruses in many ways, actually. You have a hunger virus, a poverty virus, a violence virus, an instability virus, an authoritarianism virus, a populism virus, an ignorance virus. we cannot do development without realizing we've got to sort these viruses out and see the process of sorting that out as an intercalated whole, as a totality, not bits and pieces. What this moment is a moment to see the depth of our crisis, and it is huge. And that crisis requires us to retool, because on the trajectory we are, we will not last another generation as a country. Retooling means going back. You know, what economy are you talking about developing? Whose economy are you talking about developing? How are you going to, all of us have contracted out of that economy. We don't keep our money in it. We don't keep our children in it. How many of us are sending our children to the schools that we went to? So the fundamentals of development in Nigeria need to be rethought by those who are willing to build a country in which all of us can take part. That is what this moment gives us. If we can grasp it, we can put the country on a different trajectory and trust our children to take it forward. But if we can't, sadly, the project of development will be lost, because even worse than the project of development, there will be no country for us to try to develop. Thank you.
Thank you so much, Professor Odinkalu. Simply put, we have so many issues that we need to address, aside from the issue of the health tragedy that we are facing, or the health crisis we are facing, the issue of ensuring we have a country full of leaders that have the interests of the country at heart. Now, the pandemic has thrown up so many issues. In fact, it has further exposed all the issues that Nigeria is facing at this time. And we really need to do something about it. The issues in Nigeria have been exposed by the pandemic. So without addressing those issues, we have a long way to go. So let's take a look at the public health aspect of these. Professor Odinkalu has explained, has opened up the issues that we are facing when it comes to the leadership